Следующий доклад у нас из Китая. Xianli Lu. Классификация артериовенозных мальформаций Цинхуа.
Thanks, President Kirill's invitation. Here I will introduce our experience in endovascular embolization of arteriovenous malformations.
Итак, я хотела бы сейчас поделиться с вами нашими подходами к системе классификации мальформаций.
The indicators for AVM embolization is curative, pre-operative, pre-radiosurgery, or palliative embolization. Transvenous AVM embolization is still associated with higher bleeding complications. Therefore, transarterial AVM embolization is still the mainstream in our clinical practice.
В нашей клинической практике.
But the AVM, transarterial AVM embolization is associated with low curative occlusion. It is no more than 30%. Onyx has elevated the complete occlusion rate of AVM embolization to up to 25%. Pre-operative AVM embolization is associated with lower complete occlusion rate. And the high-grade AVM, especially multi-grade AVM, associated with a lower complete occlusion rate. But with the advances of our microcatheter and embolization techniques, the curative embolization AVM embolization has elevated. But the key important of AVM embolization is it is associated with bleeding complications.
Является также ассоциация с
And the bleeding complications associated with AVM embolization is up to 8%.
Мы видим, что до 8%.
Pre-radiosurgery embolization is associated with the highest bleeding complication rate.
Наиболее высокий процент геморрагических осложнений
In literatures,
в литературе
AVM embolization has associated with decreased bleeding risk, or not changed, or elevated bleeding risk.
Либо наоборот повышенный риск рассматривается по этим.
The bleeding complications usually associated with vessel perforation, fluoridated aneurysm rupture, sinus damage, associated with onyx injection, premature vein occurrence, or catheter capture.
Также ранние окклюзии вен.
In two studies, over volume onyx injection is the only predictor for posterior post-embolization bleeding complications.
Осложнений, связанных с кровотечением.
Liquid embolic agents, the volume of agent is associated with injection pressure, injection time, and the caliber of microcatheter.
Давлением, категория микрокатетера.
We have found that with the advances of new techniques, the bleeding complications of AVM embolization is not decreased with the technique advancement, but it is still increased.
И фактически есть
And new techniques advance,
в рамках развития новых
development of new techniques
технологий
did not decrease the leading complications associated with AVM utilization, such as multiple catheter technique, hyperpressure technique, double catheter technique, keep detachable catheters, because they did not overcome the bleeding risk factors, overvolume, onyx injection, and premature vein occurrence.
здесь не купируются полностью.
Multiple session strategy
Если мы говорим о стратегии
is associated with lower complication rate and higher complete
эта
occlusion rate.
технология связана со снижением осложнений.
After AVM utilization,
После
the
эмболизации
AVM
мальформации
natural history is 1 to 3%
мы смотрим
annual bleeding risk.
также риск кровотечения в годичном измерении
The antegrade floating technique we have used we have changed our proximal plug in onyx injection technique to the antegrade floating technique. Brain AVM structures can be separated into small feeding artery, small arterial venous shunt, nidus. There are a big amount of aneurysms and aneurysmatic bulgings on the nidal venules, communicating veins. The communicating veins are at the perinidal and parenchymal tissues and draining veins. The small shunt are there are 2 small arteries and 1 small vein.
Здесь мы видим две малых артерии, две малых вены.
Proximal plug technique is usually associated with vein occlusion, premature vein occlusion, because the long injection time. And we want to embolize other part of nidus through one feeding artery. Therefore, we promote Tsinghua AVM grading system, which is used for AVM patient selection for endovascular treatment. We selected AVM patient is for ruptured AVM, superficial AVM, small AVM, AVM coexisting aneurysms, and coexisting high flow fistula. And the AOC curve for the Chinghua and Buffalo schools show the same effect. But the Chinghua classification is also associated pre-MRS of AVM patients and onyx volume injection. The antegrade drifting technique can decrease the bleeding complications lower than 5% and elevated the transarterial embolization, complete occlusion up to 50%. This is a 55 years old female patient associated presented with intracranial hemorrhage. An angiogram shows parietal AVM. Transarterial embolization was performed through 2 feeders. Then complete occlusion the AVM after embolization. Here is a temporal AVM. And it was embolized through 2 feeders and complete occlusion of the nettles. This is also a temporal AVM. Embolization was performed through 2 feeders, and the AVM nettles was completely occluded. This is a small AVM of anterior choroidal artery, and embolization was performed through the anterior choroidal artery and complete embolized AVM. This is a small AVM of anterior choroidal artery, and the AVM was nearly complete occluded. This is anterior choroidal artery AVM associated with small nettles and high flow fistula, and the AVM was completely occluded. This is a small AVM associated with a perforating artery from the basilarity, and the AVM was completely occluded. This is a small AVM of superior cerebral artery and completely occluded. This is a small AVM through the posterior medial choroidal artery, and it was occluded through transarterial embolization. This patient presented 2 AVM nettles, one in frontal and the other is in basal ganglion. On the CT, we found the AVM rupture was caused by the posterior part of the AVM. Therefore, we embolized the posterior part of the nettles. Here is a AVM of the posterior medial choroidal artery and completely embolized. This is a small AVM, residual AVM after surgery resection, and this AVM was embolized. This is also a residual AVM after surgery resection, and embolized completely. The superior is one case, and the lower is also another case. This is a frontal AVM and embolized through 2 feeders. This is the anterior cerebral artery AVM and embolized completely. This is a giant AVM of cerebrum and associated with stenosis of sigmoid sinus. So this AVM was embolized, and this sinus stenosis was also palestine. The AVM was nearly completely embolized. A conclusion: a small, deep location and surgical residual AVM, we can curative embolize these cases. Sonic and Apollo tip detachable catheters did not decrease the bleeding complications because as catheter capture caused bleeding complications is low in our clinical practice. Premature venous occlusion is the main causes of pre and post bleeding complications in AVM utilization. Multiple suppliers catheterization can increase AVM complete occlusion rate and decrease the complication risk. Pre-radiosurgery AVM immunization should targeted to bleeding factors and should not be to shrink the AVM volume. Thank you.